Hola, soy la doctora Cintron. Estamos aquí en la clínica de Belladonna Medical Wellness, en la clínica de Bayamón. Hoy tenemos el honor y el privilegio de tener al doctor Gary Donovitz. El doctor Gary Donovitz es ginecólogo obstetra por 30 años, con mucha experiencia, y él es el creador de BioTE Medical. Adicional, es el director del Instituto Hormonal de Texas de BioTE. Esta gran innovación. Welcome to our office. Thank you for being here.
Thanks for having me.
We're very honored that you decided to have some time to talk to my patients and to the patients that are watching TV today. And we'd like to ask you some questions to know a little more about BioTE. BioTE is already heard a lot. A lot of people come just for the name because they have heard of hormones and how people are getting healthier. Well, actually, millions of men and women are living longer last years, and we have doubled the lifetime expectancy. And our government, our health system is really not doing a lot to cope with all those people that are living longer. And I know you have a vision. I know you created this system that can help age healthier and live happier. How is it? Tell us about it.
Well, the problem is people live longer, but their quality of life is not good. So you live longer, but you have more medical problems. You get on more drugs, more pharmaceuticals, and the pharmaceuticals make you feel worse. So as you get older and you're on more medications, you really are not living happier because you're living actually sadder and you're not in a good place. So what we did was come up with a way to optimize your hormones early, and especially in the Latino population where you have so much diabetes, it would be great to prevent it versus have to treat the diabetes. It would be great to prevent heart disease, which we can do. It would be great to protect your brain. It would be great to reduce your risk for breast cancer and prostate cancer. So what we did was come up with a method where we could do all of those things. Then the second half of life becomes much better. Your quality of life is better and you want to live longer. So you have better quality of life no matter what your age.
That's exactly what I read here. This is the book, Age Healthier, Live Happier. And all you're saying, it makes a lot of sense now that we've been doing a lot of patients and the feedback. They're talking about leaving some medications that they had before for anxiety, for not sleeping well, for libido and all these other things. There's 80% of our clinic here in Belladonna are women that they come for weight loss, 80% of them, and these women are looking for other options because we understand already that losing weight is not about only diet and only exercise. It's more than that. It's hormones, and I know this system can help people get leaner faster. How is it that can help?
Well, the problem is even if you work out, and even if you cut back your calories, and even if you cut back the fat that you eat, so you're eating cleaner, the problem is if your hormones are not optimized, it still won't work. And here's the thing, if your hormones are not optimized, that includes thyroid, that includes testosterone and estrogen, then what can happen is you become insulin resistant or pre-diabetic. So your insulin levels are very high, and you don't metabolize your food properly, and you'll never lose weight. So if you optimize your hormones and then accept the lifestyle changes that you talked about, it works much better together. So for us, we optimize the hormones and then continue the lifestyle changes, and then you will be productive. Things will happen good. You will lose weight, you will lose the belly fat, and when that happens, it's much better. So you feel better about your workout because it's working. You don't get discouraged.
That's exactly what we have been seeing in patients. I really like the protocol of BioTE because it doesn't help you only with progesterone or testosterone or estrogen. It looks into vitamin D, which is a very important component, and thyroid for your metabolism to lose weight. Another questions I have, we live in an era of a lot of cancer, and when people come over here in the office, they ask me always if they have to worry, if they have to be worried of prostate cancer for men and receiving BioTE therapy for testosterone replacement. How could you help us to understand that?
Right, so it's been thought for a long time that testosterone caused prostate cancer, but there's actually 0 studies that have ever shown that. In fact, if you take testosterone, you actually reduce your risk for prostate cancer. If you were to get prostate cancer and you were on testosterone pellets, the chance that that prostate cancer would be less aggressive, not more aggressive, but less, is much higher. So, in terms of living longer again, and in terms of reducing your risk for prostate cancer, testosterone pellet therapy is what you want to do. Not stay with low testosterone. If you do that and you develop a prostate cancer, which is one of the most common cancers in males, it's more likely to be a very aggressive cancer. Even if you've had prostate cancer already, you can still get pellet therapy after you get treated.
Very good. So in the case of women, that there's a high incidence in Puerto Rico, 3 women, of every 3 women, 1 of them get breast cancer, and there have been evidence about breast cancer protection in this treatment. Can you
Sure. So there's now 3 studies, one of which was ours, that shows about a 60% reduction in breast cancer. In fact, I looked at some statistics yesterday for the Latino population, whereas in the United States, our biggest killer for men and women is heart disease. For you guys, it is cancer. And so you really want to try to reduce your risk for breast cancer. Many women who've had breast cancer have been told you can never take hormones, which basically gives you a horrible quality of life. Your memory goes, you don't have any energy, you don't sleep well, you're depressed, you're moody, you gain weight, especially in the midsection. And so those people, I think their quality of life is horrible, and they're on all these medications. So even if you've had breast cancer, you can have your hormones optimized and have a better quality of life and really feel better. If you haven't had breast cancer and you want to prevent it, hormone optimization, specifically using testosterone, is what you want to do.
What is the ideal candidate for pellets? And in your experience, I mean, I had a really great experience when I went to Dallas in that clinic, because I saw a lot of patients that have already like 7 to 8 years being on pellets, and they experience great health. And what is your candidate that you will say this is the best candidate to have a replacement in BioTE?
Well, so many people that come to your office are candidates. Probably the person that just left was a great candidate. People that work for you are great candidates. Your family is a great candidate. Women after the age of 25 are going to start losing their hormones, right? And they need to start replacement early. Not get on antidepressants and anti-anxiety drugs and fad diets, diet pills. Men in their 30s start losing hormones. So early on, they need to have those replaced. So your ideal candidate is every woman after the age of 25 and most men after the age of 30 or 35. And it doesn't matter how old you are. I have men and women who are in their 90s still on pellet therapy. So I never give up, because you always can make those people have a much happier life. And if it was your family, you'd want them to be treated. So the ideal candidate is everybody from 25 on, or 35 and males on.
Estoy bien agradecida del Dr. Donovitz que está aquí con nosotros. Thank you very much for being here and taking this time of your trip to come to my office and explain to our patients more about BioTE.
Thanks for having me. Thank you.